The protests since the death of George Floyd are highlighting the same issues that we see in the eating disorder world, which is that, we live in a society where racism is the way it is, and where if you are a person of color, you may not have the ability to get treatment.
Hi there. Welcome to Students of Mind, the mental health podcast made by curious minds for curious minds. On this podcast, we, the hosts, are just like you, eager to learn more about the mind. Here, we learn with you and provide you with clear, concise information backed up by real experts about all things mental health. My name is Jayde, and today I'm sitting down with Dr. Carolyn Ross to talk about eating disorders, eating disorder treatment, how eating disorders are experienced in communities of color, and what it's like to be a Black woman and an eating disorder professional. Today's guest is Dr. Carolyn Ross. Dr. Ross is an expert and pioneer in the use of integrative medicine for the treatment of eating disorders and addiction. She is the CEO of the Anchor program, a 12-week online program for people struggling with binge eating, food addiction, and emotional eating. Dr. Ross is the author of 3 books, and she shares her knowledge and expertise with treatment centers around the country to help them develop effective eating disorder programs. Dr. Ross is also a chair member of the African American Eating Disorder Professionals Committee. Welcome, Dr. Ross, and thank you for being here.
Thank you so much for inviting me.
Yeah, of course. So I know I said a little bit about you and the work that you do, but could you tell us more in a little more depth about you and the work you do and how you got to where you are today?
Sure. I'm a medical doctor. I completed medical school at the University of Michigan, and initially just wanted to work in primary care, and I had several offices that I ran. I was always in private practice, but I also always had an interest in working with women. So as part of my interest in working with women, I ended up doing a lot of work on eating disorders. And that's how I kind of first got involved in working with eating disorders. So for quite some time, I've either been a medical director of eating disorder treatment centers or a consultant with treatment centers, and then have had, worked with people in my practice who have eating disorders as well.
Okay. So I think first what I want to ask is, if you were talking to someone who has no knowledge of eating disorders whatsoever, how would you describe what an eating disorder is and the role that they play?
So somebody who came from another planet and had never... Okay. Yeah, I think the best explanation that I can come up with is that eating disorders, while they involve food and body image, it's really these disorders all function from people's inability to manage their emotions, particularly emotions around certain topics and certain experiences, I should say, not topics. So people with eating disorders tend to use food in a way to help them manage emotions, especially people who have had traumatic experiences, particularly in childhood, because those traumatic experiences, change things in a person's brain and make it difficult for them to manage their emotions. And often food or behaviors are used as a way to, to stay in control and to manage those emotions.
So right now, what are the known types of eating disorders, and which of those are the most common?
Yeah. Well, I think most people know about anorexia and bulimia. And 10 years ago, binge eating disorder was put in the Diagnostic and Statistical Manual. So now it's considered a true eating disorder. And then there some ancillary ones like one we call other specified feeding and eating disorders, which are kind of for people who don't fit the specific criteria for anorexia, bulimia, or binge eating disorder. They might be put in that category. And then there's another category that's mostly not to do with body image. The people in it's the initials are RFID. Oops, now I'm going to forget what it is. That's embarrassing. But the RFID category are often people who have autism, and their issue is not so much, body image. It's more about the texture of food, and how it's avoidant reactive food intake disorder. I hope I can be forgiven for forgetting that long title. Anyway, I think most people feel like because we know they've heard so much about anorexia and bulimia, they probably think, oh, those are the most common ones. But actually, binge eating disorder is more common than anorexia and bulimia combined. So, and also the other difference is that binge eating disorder has more men in it than do the other eating disorders. So about 40% of people with binge eating disorder are men, whereas it's a much lower percentage for anorexia and bulimia.
Okay, that's interesting to me. I didn't know that binge eating disorder was more prevalent than bulimia and anorexia combined.
Yeah, I don't think most people realize that because for years and years, the only eating disorders we even talked about were anorexia and bulimia, and everything else was considered what we called eating disorder not otherwise specified, or EDNOS. So everything else was just piled together under EDNOS, and nobody really talked much about it. And then about 10 years ago, there was a lot of research and kind of a push to recognize binge eating disorder as a true part of the eating disorder spectrum.
Mm-hmm. Yeah, and I think even in my journey with my eating disorder,
Mm-hmm.
I started my recovery 4 years ago, and even then I rarely heard anything mentioned about binge eating disorder. So I think even in the short 4 years that I've been in recovery, I've seen an improvement in how much people are talking about it and spreading awareness about it.
Yeah, and there still aren't a lot of treatment centers even for binge eating disorder. So, yeah, I think there's certainly a lag, just as there's a huge lag in the recognition of eating disorders in people of color, Black, Indigenous, other people of color. And, I think studies have shown that if you present a therapist with the exact same symptoms that a patient coming in has, but you tell the therapist that one is white, one is Hispanic, and one is Black, the Black person will only be diagnosed with an eating disorder about 14% of the time, whereas white and Hispanic with the exact same symptoms will be diagnosed over 70% of the time.
Wow.
So there's a huge bias about, whether Black people can even have an eating disorder, which is crazy because the studies show that, Black Hispanics have the same percentage of eating disorders that do whites. There's not as much research in Native Americans and Alaskan Natives, but they also suffer for approximately the same amount from eating disorders.
Wow. So we're definitely going to come back to race and how that plays a part in eating disorders, because I want to talk about symptoms and behaviors, because I don't know if people can really identify what it looks like when someone is engaging in an eating disorder behavior. So I know that it can look different depending on the person, but can you talk about anorexia, bulimia, and binge eating and what their typical behaviors are?
Well, we have we have specific criteria for each one, and I can go through those, and I think that's how we measure whether or not someone has that diagnosis. So for anorexia, it's inability to maintain a healthy weight. Um, they used to say loss of menstrual cycle, but surprisingly nowadays a lot of women continue to have their periods, and also men don't have periods. So they finally took that out. But that inability to maintain weight, and then a distortion of body image, so that when a person with anorexia looks in the mirror, they see someone who's much larger than everybody else sees. So I think for all of the eating disorders, there's a common underlying um, thread of your self-evaluation being very dependent on your size, your weight, etc. So you can put that across the board for anorexia, bulimia, and binge eating disorder. And I think it's more rational to call them behavioral addictions rather than necessarily an eating problem. But the eating behaviors associated with anorexia are mainly to do with restriction. So, not eating enough food, keeping yourself from eating adequate amounts of food for fear of gaining weight. And then for bulimia, same self evaluation related to weight and shape, but the main behavior is the binge. And a binge is eating a large amount of food in a short period of time, usually 2 hours. And then with bulimia, it's followed by some way of purging. And so that could be self-induced vomiting. It could be the use of diuretics or laxatives, or even compulsive exercise. So those are the first two. And then binge eating disorder is characterized by the binge. Again, it's that eating that large quantity of food. And there is no compensatory purge. And there's a lot of emotional distress centered around the binge, just kind of feeling, eating in isolation for fear of being embarrassed about how much they're eating, feeling a lot of guilt and shame about how much they're eating, and so on.
I want to ask, of course, I know that eating disorders aren't all about the food, but I feel like it's hard for some people to grasp, it's called an eating disorder. So why can't we just fix this person's eating and then they'll be cured? So
it sounds so simple, doesn't it?
Yeah.
That's one of the things that people who have eating disorders hate the most, because parents or loved ones will say, well, just eat if you're an anorexic. Or if you have binge eating, just stop eating and get more exercise, then you'll be fine,
Right.
It's not really that way. So I think the names are problematic, and we're really coming to only now, I think, starting to come to an understanding that even weight isn't the biggest factor. Because before, we've always said, oh, if you're underweight, then you must have anorexia. If you're normal weight or a little overweight, then you must have bulimia. If you're living in a larger body, you must have, binge eating disorder. And now we're seeing that isn't even 100% true. So, I think we need to go deeper and look more at the underlying causes. And when you look at trauma as an underlying cause, it's pretty significant that a high majority of people seeking treatment for an eating disorder have a history of some kind of childhood adversity. So when I say trauma, a lot of people think, oh, it must be sexual abuse or something, even worse. But it can be things like, coming from a family where a parent has a mental illness, or the parent has a substance use problem, alcohol or drugs, or maybe someone in your family. Also, there's the genetics, but also in terms of trauma, someone in your family who, may be incarcerated, or there's just a long list of other things: household dysfunction, emotional abuse, neglect, which is something people really don't talk about, but children whose needs have never been met, either because their family is so dysfunctional, or, maybe their personality disorders in the parents, but where the child just feels alone and doesn't have their needs met is also a sign of adversity. So we're just really seeing that link between childhood adversity and eating disorders, as well as addictions, is becoming even more important.
Okay. So with any mental illness, there's always some misconceptions attached. So, what are the most common misconceptions about eating disorders that you come across in your work?
That it has to do with wanting to look good. That people with anorexia, they're just concerned about how they're going to look in a bathing suit. And it certainly may seem like that on the surface because there's such a focus on body image, and there's such a distortion in body image, particularly in anorexia. But that's a misconception. It's not really true. The misconception that Black people don't have eating disorders. The misconception that um, even the misconception that eating disorders are all about control. I mean, for a long time we used to say that people with anorexia, the reason that they restricted was because they had to control things. I think that's, to a degree that there is some truth to that, but that's not the entire truth. Um, yeah. So yeah, I think there are a lot of misconceptions. Oh, that men don't get eating disorders. How about that one? Yeah.
So, I'm always curious about like where these misconceptions come from and like what it is about eating disorders that like cause people to make all of these assumptions.
Mhm. Yeah, I think it's just like anything else. It's ignorance and stigma. There's a lot of I mean, I have patients who are naturally underweight. They just haven't grown into their bodies. And even they are stigmatized for being too thin. So I think there's just in society, if you're different in any way, whether it be the color of your skin or the size of your body or, anything else that's different about you, then people people are going to judge.
Um, so you talked a little bit about society and how, there's so many images of what the perfect body is.
Mhm.
Um, and I think that in my kind of exploration of eating disorders, I find it troubling how some of these like dieting trends are so blatantly like similar to eating disorder behaviors and how like
That's an understatement.
yeah, like nothing's being said about it.
Diets are the number one cause of eating disorders, really,
Yeah.
or the number one trigger, at least. I mean, you have to have, for many people, they may have an underlying predisposition to eating disorders, like I said, genetics, um, or trauma, etc. But diets are often the number one trigger where somebody who is vulnerable will go on a diet with it. I remember a kid a male patient of mine who started dieting in middle school with a bunch of friends. They just all went on a diet together, and his friends got bored with dieting, and he just kept going, and he couldn't stop himself. And that's how it all started. I don't know if he hadn't gone on that first diet, if that would have been the case. So diets are dangerous. It's very upsetting to me, and I don't want to get too much on my soapbox, but it's upsetting to me that diets are still being promoted, not just in society, because we understand society is all about making money. The diet industry is a $60 billion industry that is off the backs of primarily women, and even young women, like teenagers and children, are put on diets. And so, people are making money off of this notion that you have to look a certain way in order to be acceptable. And it's just wrong. And even more wrong is the fact that, medical professionals who honestly know nothing about nutrition. There's, at least when I went to medical school, there wasn't one nutrition class that we ever had to take. And I don't think it's changed much. And yet doctors feel very comfortable, cavalierly recommending diets, which could then lead to eating disorders in their patients. I did get on my soapbox a little there, so I'll stop.
No, that was like my next question. Like I'm wondering because I've had experiences where doctors were just completely insensitive to the fact that I'm an eating disorder patient.
Mm-hmm.
And I've heard that across the board from like friends that have eating disorders, stories I've read online. Has the kind of like disconnect between medical doctors and eating disorder patients, has it gotten better over time?
No, I mean, I am a doctor, and I've had doctors tell me that I should go on this diet or that diet or whatever, to lower my cholesterol or to whatever they think, lose weight, etc. And honestly, I get very angry about that, because I really think, if we had, if we had a pill that would enable people to um, overcome their biology and lose weight, I don't even think that's a good thing. But we don't have a treatment for any of this. We don't really have even, really good treatments for eating disorders. It's, many people go into treatment and then they relapse again and again and again. Same for addictions. So there is no treatment, and recommending diets just makes everything that much worse. Everything, it's very useful to recommend to people that they be active and, you know, find happiness in their lives, that they meditate to deal with stress. Those are really good recommendations. But putting all your focus on the number on the scale is a really bad recommendation. They aren't trained, doctors aren't trained in eating disorders either. They receive very, very little training in eating disorders. So, for a doctor to pretend that they are knowledgeable about that is, it's a farce.
Mm-hmm. Yeah. And then, like, as someone who has an eating disorder, it's just so confusing when I'm told by this, doctor, therapist, psychiatrist on my eating disorder team that it's okay for me to be doing this meal plan and eating this much. But I go to my doctor and I see like even just like posters on the wall of like, this is what you're supposed to eat. This is what your plate is supposed to look like. It's so confusing, and like it just makes it harder to accept that you even have an eating disorder,
Mhm.
or that eating disorders are even real.
Yeah, well, I mean, I think there's an author recently who said America has an eating disorder. And I think that's true because we're obsessed with appearance, and the social media has just made that even worse. However, if you have an eating disorder, I would never take advice from someone who is not a specialist in treating eating disorders. And I think the whole notion of what you should eat, how much you should eat, the plate plan, the not plate, it's confusing for everyone. I've been in medicine for decades, and during that time, we were told fat is bad for you. And then we were told, oh no, fat is good for you. You need fat because, I mean, you have to have hormones. So, duh, you have to have fat to have hormones. So, people going on low fat diets definitely don't have enough hormones to have periods and so on. So, that got next. And then it was low carb. Oh, carbs are so bad for you. You've got to stop eating carbs. oh, then we forget about all the nutrients that are in true carbs. I'm not talking about, you know, processed food. I'm talking about fruits and vegetables have nutrients that our body needs. And so then it was, okay, well, maybe we could eat some carbs. And now it's all about sugar. Can't eat sugar, can't eat sugar. I mean, if you think about that, it doesn't make any sense, because if you're listening to all of that and you look back at the history of that, you can see that it's it's really all a money making game. And even if you discount that, and maybe some people really, had done research and really wanted to do something good, they didn't know what they were doing, because then they had to retract everything. So we cannot listen to popular media. We cannot listen to, what's on TV about what to eat. We cannot go down those roads. And I think it's important for everyone, but even more important for people with eating disorders, to try to limit their exposure to those kinds of things.
So for people who are able to access treatment and resources for their eating disorder, what types of treatments are out there and what's being used for people looking for help?
Yeah, well, I think the standard treatment has been the 30 to 45 to 60-day inpatient or residential program, which is fine. I think that's a good treatment for people who need stabilization. Maybe they're not medically stable, or they are unable to stop their behaviors on their own in the outpatient setting. And then after that, there's what we call partial hospitalization, where you may be at a treatment facility for anywhere from 6 to 12 hours a day, and then you go home at night. And then below that is intensive outpatient treatment, and that can be spending anywhere from 3 to 6 hours a day at a facility, and then the rest of the time you're on your own. So, there's definitely benefit to all of those, but we have to really recognize that eating disorders are chronic conditions. They're not going to be cured in a 30-day program, or even a 60-day program. So it's really important that people have options to work with um, experts in the field once they've completed the treatment program. And that's where I think we don't have enough help for eating disorder patients. It's one of the reasons why I developed an online program for binge eating disorder, because having worked in many treatment centers and seeing how people, they do so well, and they're feeling so good, they're on top of the world when they leave the program, and then next thing you know, they've relapsed, and they're in that spiral. And then they, some patients who have had like gone to 17 or more treatment facilities, and that just, first of all, is a lot of money that most people can't afford. And second of all, there's something wrong with that if, we can't provide care that helps keep people from relapsing. So in my online program, I take people from all over the world, actually, and we have a program that's an intensive program for a few months, and then a 6-month program after that, that helps them to stay, on track. And so that's what I do with people with binge eating and compulsive overeating, emotional eating, food addiction. And I think we need more of that, where, because you may live in a city, but a lot of people go to a treatment program, then they go home to some tiny town in Iowa or Michigan, where there are no doctors who know anything about eating disorders. So we need more access to specialists for treatment.
Okay. So, in these programs, because I know you said like a inpatient PHP IOP track,
Mm-hmm.
within those programs, what types of therapies are being used to help with the recovery process?
I think the most common still is cognitive behavior therapy. And there's also a lot of dialectical behavior therapy, or acceptance and commitment therapy, which is used to help people become better at emotional regulation. So those tend to be the most common. Some programs have family therapy, family systems therapy. Those are also, and some programs also use different trauma therapies, whether that be EMDR or somatic experiencing or one of the other trauma therapies.
So in your opinion, what is the most effective? Which I know is kind of a relative question because therapy is different for everyone, but
Well, I really believe that while not everybody who's had childhood adversity or trauma in their lives will develop an eating disorder or an addiction, most of the people that I've worked with have had a history of trauma. So most of the patients I've worked with eating disorders have a history of some kind of adversity in their lives. And so I really believe that, trauma therapy is super important. And I think until recently, I think most treatment centers did not really focus on that. They were more focused on weight restoration for the anorexic and stopping behaviors for the bulimic and so on. But if you don't deal with the underlying causes of the eating disorders, people do keep cycling back. They go home and then those memories or whatever happened to them, or going back into a dysfunctional family without knowing how to manage that, causes relapse.
yeah, it's interesting how when you're talking about trauma and eating disorders, because I've mostly heard eating disorders being a way to cope with like anxiety and depression.
Mm-hmm.
And I remember being in treatment and there weren't like any trauma based groups
Mm-hmm.
except for one that was only for like a select group of people. So it was like they would go off during the day somewhere and have their own trauma therapy session.
Yeah. Yeah. And I think that for the most part is how it still is. And it really shouldn't be that way. I think in the treatment world, mainly they were identifying trauma as what we used to call the big T. So big T is obviously stuff like sexual abuse or, I don't know, just really the worst of the worst. But now with the adverse childhood experiences study that the Centers for Disease Control has been running, um, they're pretty clear that childhood adversity, from neglect to all sorts of abuse, even emotional abuse, physical abuse, emotional and physical neglect, as well as those household dysfunctions like uh, domestic violence in the home, substance use in the home, mental illness in the home, etc. All of those markedly increase a person's risk for developing, um, some kind of eating issue.
Okay, so now I want to shift our conversation to talk a little more about race and how people of color have a little bit of a different experience with their eating disorders. Um, so the first thing I want to ask is, I know that you are a member of the African American Eating Disorders Professional Committee, and I want to ask, what do you think the importance of having this committee is?
Yeah, well, this is a committee of IADEP, which is the International Eating Disorders Professionals Organization. And it's the premier organization, mainly for therapists and people who work in the eating disorder field, dietitians, et cetera. And, for many, many, many years within that organization, there was no recognition that, number one, people of color get eating disorders, and number two, that there may be differences in how we need to address those. So I think I wasn't the founder of the committee. I'm the co-chair right now. But two of my colleagues, Ms. Fuller from Duke University and Charlene Small from University of Richmond, founded the committee. And I think certainly since I've been the co-chair with another woman who is from Renfrew, Paula Gaithel Edwards, we've really been focused on education and getting the word out that Black people do get eating disorders and that we need to really pay attention to that. And we're missing, a whole lot of people who need help. And so I think the importance of the committee is raising both the educational level and also awareness level of the need for recognition of eating disorders in people of color.
So now I want to ask, how is the experience of having an eating disorder different for people of color?
I think there are a lot of similarities. The diagnosis, the criteria are the same, and so on. But I do feel there are cultural differences, and certainly in the AAEDP committee, that's one of the things we are trying to educate people on is how to become culturally competent. So you're not, making a person's life and eating disorder worse by microaggressions, for example, or misidentifying their cultural identity or making assumptions about their culture based on, all the things that people do, the color of their skin or, where they live in the country, et cetera, et cetera. So I think there's, all of the protests since the death of George Floyd are highlighting the same issues that we see in the eating disorder world, which is that, we live in a society where racism is it's the way it is, and where people of color do not have the same opportunities. So, for example, if you are a person of color, you may not have the ability to get treatment financially. So that's one thing. And then if you go in and get treatment, you may be the only person of color in your treatment group, and there may be no therapists, doctors, or dietitians who work with you. So, I mean, we joke about, in my friend Charlene Small, she has this joke about, well, you may be given a challenge to eat a piece of pie, and you're given, a pie with an orange substance in it. And for many Black women, that might be, they think it's going to be sweet potato pie, but then they put it in their mouth and it's pumpkin pie. Now, not all, that doesn't apply to everyone because, many Black people are very acculturated now into the dominant society. And so may have those kinds of things may not be the case. But there are things like, how you need to take care of your hair, how much focus is put on, your hair and, people coming up and wanting to touch it and all that kind of stuff. So it's just not finding yourself seen in the same way as we would hope, or in the same way that a white girl with an eating disorder is seen in treatment.
So you're talking about, how that experience is in treatment. I know for me, a lot of, I guess, the differences I've noticed between my eating disorder experience compared to my white friend's eating disorder experience is how I was treated in my home when I was engaging in behaviors. So I'm wondering, in your patients of color, is that something that shows up as well?
Well, I do think that in the Black community, first of all, there's a bias against getting help for any mental health or behavioral health problem. And so that can be a real problem for someone who has an eating disorder, being able to get the help that they need. Is that what happened for you? Yeah.
Yeah, I think also just not understanding the kind of weight of what I was experiencing and kind of blowing it off as, oh, she just doesn't
It's
want to
just
eat.
a stage. It's just a stage. Or, yeah. And that, I think that happens a lot. Or I went through something like that and I grew out of it. So you will too. So again, I think there's a lack of education, and there is just a strong bias that comes from hundreds of years of experience of Black people having, negative experiences with the healthcare profession.
Yeah. Um, so you've talked about this a little bit, but I just want to touch on like what are some of the specific ways that racism shows up in the eating disorder world?
That's a really good question. What I've experienced is racism shows up in a lot of ways. From a professional standpoint, it is in the fact that um, clinicians of color are not being hired to work in treatment centers. And until the George Floyd protest, honestly, nobody seemed to care about that. It was kind of like, why are we even talking about this? Yeah. So, and they would explain it by saying, oh, well, we don't have people of color. But it's interesting that just as white clinicians have been for generations treating people of color, Black clinicians, I'm a Black doctor, I treat white people. So, but they don't see that in the eating disorder world, that, having a Black clinician is not just for Black patients, it brings diversity throughout the center. So that's one way that racism shows up. The lack of recognition and diagnosis of people of color with eating disorders is another way. The lack of availability of treatment, helping people get in, offering scholarships if needed, um, all of those kinds of things, I think. And then there's, I think, the individual one-on-one connections where there's a lot of microaggressions that happen. There's implicit bias that happens. Oh, that whole thing about, well, Black girls don't care if they're bigger because that's part of their culture. So, and that's not true for every Black woman, So I think there's a ton of ways that it shows up.
Can you talk a little more about just being a Black woman in the field that you're in, and just how that experiences has been for you and how you decided to get into this field that's proven to kind of be against you?
Yeah, that's sort of a loaded question right now because I've personally been going through kind of a big shift in my own like internal world that started with when I gave a TED talk. I don't know if you saw my TEDx talk.
I watched it last night.
Yeah, well, you know, I was very lucky to have the opportunity to do a TEDx talk, and my talk was on intergenerational and historical trauma. So I gave my talk in January, and then I've been speaking a lot on the same topic since then. One of the talks that I gave to clinicians online was the day after George Floyd was killed. And I started to see in doing the TED talk, um, just a little background on me that, I grew up in the South, in the Jim Crow South when I was born, and through most of my childhood, up until high school, I went to all segregated schools. And, we had the back of the bus thing, we had the separate water fountains, you can't sit in the movie theater unless you sit in the balcony. My grandfather was a doctor. He wasn't allowed to be on the staff of the White Hospital. All of those things that I saw growing up. I saw how people treated him. We knew that he was born on the same plantation where his parents had been slaves. And he achieved a lot in his life, and so did my parents, and so did I. But when I looked at when I started doing the TED talk, it brought up all of these memories for me from the past. And the reason that was a problem is because I had hidden those memories from myself in order to fit in. I went to a white medical school. I didn't go to a historically Black college. I thought I'm just going to keep achieving even more than my parents did, who went to historically Black colleges. I wanted to do better than that. And throughout all of that, I think a part of who my identity as a Black woman was sort of submerged. And I was just, I'm just doing my job. I'm just getting out there, I'm taking care of my family. I'm working hard. I don't have to think about being a Black woman. And it's really not true, because now it's kind of hit me at this stage in my career, which is, you know, I couldn't have done anything before because there was no openness to talk about this. And now there is some openness to talk about it, but also a big part of my career has been lived without that. Without that as being a part of me in a way. I don't know. I don't know if I'm getting that across, but so I when I look back, I realize that so many times where I was marginalized because of who I am. I was given an opportunity, but then I was paid less for it, or I could go and speak at a major conference, but I could only speak about Black people. Which my area of trauma, my area of expertise is trauma, and I had a hard time getting on the speaking circuit to talk about trauma. But as soon as I started talking about African Americans with eating disorders, then I was very popular. So you see what I'm saying?
Yeah.
They are little things, they really are in some ways little things. But I think over a period of time, they pile up and you start realizing how much you've lost, how much you've gained, but also there was a cost.
Yeah.
So
thank you for sharing that. I feel like that was very vulnerable. So thank you for that. I think that especially as Black women, it gets lost. The work gets lost a little bit. And like seeing someone like you, I am inspired, and kind of the idea of your struggle isn't even in my mind, because I'm like, wow, she's so strong and she's doing all of these things. And
but
I
that's
think
even part of it, because you're so strong is the strong Black woman syndrome.
exactly.
And that's how we had to be in order to take care of our business. But there's always a cost to the strong Black woman syndrome. Don't fail to recognize that there's a cost.
Mm-hmm. Yeah. And so because of that, I'm really touched that you felt like comfortable to share that you were struggling a little bit. So thank you again for that.
Okay.
So when I was looking for someone to have on the show to talk about eating disorders, but also eating disorders in Black communities, and I found myself unconsciously seeking out white experts when I was thinking about the just eating disorder portion of it, and then seeking out Black experts for the people of color portion of it. Hi guys, I wanted to pop in here really quickly and provide some clarity for what I said, just because I don't want it to be taken out of context or anything. So when I was looking for and reaching out to eating disorder experts, I noticed as I was looking back at all the emails I sent that all the people that I contacted for general eating disorder information were white, and all the people I contacted about eating disorders in communities of color were Black. And initially I was in the mindset that, these two things, just general information about eating disorders and eating disorders as it pertains to people of color, I was in the mindset that they had to be separate conversations. But in realizing the trend of all of these white experts that I, came across, and came up in my searches and contacted, after I realized that trend, I thought it was even more important to have a Black voice speak on both topics, both general eating disorder information and information about how eating disorders affect people of color. I thought it was important that we have a Black voice speak on both of those topics so we can start normalizing Black voices in the eating disorder community, but also in the mental health community in general. Thank you so much for understanding, and let's get back into the show. And then I was like, wait a minute. Why am I doing that?
Wake up, girl.
Yeah. I was like, wait, that doesn't make any sense when,
that's now you see how the white world operates.
Yeah.
That's how they operate,
Mm-hmm.
And it's not surprising that you would do that because that's kind of how we've been trained.
Yeah. Yeah. And I think something I've been exploring is how there's so much anti-blackness within the Black community and how we have to go within ourselves to see how, the society that we live in has caused our values, some of them, to be against ourselves.
Yeah. Well, that's called internalized racism. Yeah. And I was just watching, this is an old thing on YouTube where Louis Farrakhan and also Malcolm X had, they put Malcolm X on YouTube. So funny. YouTube wasn't even invented when Malcolm X was alive. But they were talking about this same thing. I remember Malcolm X's YouTube video where he was saying, who taught you to hate your Black skin? Who taught you to hate the shape of your nose? Who taught you to hate, your Black body? And that's the way it is because, this we can no longer ignore the legacy of slavery, which was to demonize the Black body, and especially for Black women. Slavery was the beginning of the creation of the thin ideal, which was in contradistinction to, how white women should be. White women should be chaste. They should be thin. They should be religious, sanctified, etc. And then they talked about Black women's bodies as savage and sinful and, sexualized and so on. So that's the beginning of the thin ideal. So you're talking about eating disorders. It's this whole thing, it traces directly back to how Black bodies were treated in slavery. And, there's still, obviously, because of the whole situation now, we're still seeing Black people, whether they be, you think about John Lewis and being on the Selma March and, all that MLK experienced, where women and children were beaten and fire hoses were put on them and little children in a church were blown up. And so the beginning, really, of eating disorders was the creation of the thin ideal. And that thin ideal started back in slavery. So, a lot of Black people don't feel like, why should we go back and talk about something that happened, years and years ago? When you look at all of the history, we've all been saying the same thing. You go back to Martin Luther King, John Lewis, Louis Farrakhan, Malcolm X, all of the new people who've been Ibram Kendi, all of those people, all saying exactly the same thing. They're not saying, they're all saying we just want to be accepted in our own country and to be recognized for what we've done. And in terms of eating disorders, part of that recognition has to be that, we no longer demonize Black women's bodies. And we no longer have these stereotypes. Either you're the mammy who took care of the white people's family, or you're the sex pot that you see on the, on some of the music videos. I mean, there's a whole right, or you're the strong black woman who's overcome everything, but she's a mess, inside, right?
Right.
So anyway, that's what I was saying.
Wow. So this is just such a deep-rooted issue, and I'm wondering, where do we even begin with kind of unlearning the things that have brought us to where we are today? Um, like with the African American Eating Disorder Professionals Committee, like what are the things that you guys are doing to kind of
Yeah.
help the situation?
Well, we have a page on the IADEP website under AADP-BIPOC, and we do webinars there. We do we do blogs. There's member salutes to tell you what other members are doing. I mean, our focus is really educating eating disorder professionals. And I think within that focus, each of us individually want to educate at the broader world. Like I speak at a lot of national and international conferences, which are now virtual, which is kind of cool.
Mhm.
I can get more done that way. I don't have to fly to New Zealand to speak. I can just go on Zoom. So, yeah, so I think AADP BIPOC is really about educating and promoting diversity within the eating disorder community. In terms of people like yourself who are listening and want to know what they can do, I think the first thing is, really educating yourself about the history, because most of us weren't taught anything about Black history. That's why I find it so interesting to go back, and now all this is on YouTube, and listen to some of the talks that some of these people have had or have done way, way long time ago. Many of them are now deceased or were assassinated. Um, and listening to them talk about, these issues helps us to stay awake or woke, as you guys say. And just being aware within yourself, just like you said, you were going to go to white people talk about eating disorders and go to a Black person talk about Black people with eating disorders. You have to just stay awake to the fact that we've been swimming in this white racist, white supremacist society for all of our lives. So there's no way we're not going to have, picked up some of it or a lot of it, but we just have to keep being more and more aware. And I think once you start, like I was talking to my sister, and she's always been kind of a moderate Black woman. She has African statues in her house and African paintings and all that. But she was never one to come out and want to talk about slavery or anything like that. But once she and I started talking, and I was sharing with her what I just shared with you about what happened to me, because I did my TED talk in Texas, where my sister lives, and she couldn't understand why after the TED talk I was so upset I could hardly. I'm not easily upset, let's put it this way, but she was shocked that I was just so upset. And I wasn't upset that I had done the TED Talk. I was upset that the TED Talk had brought up all that stuff for me. And I was trying to tell her, and she just couldn't get it. It's like, well, that happened. It was a long time ago. I mean, you did a great job, blah, blah, blah. Okay, but now the protest happened. She's getting more awake. Now I keep bringing up the TED Talk, and I keep bringing up what happened to us as children. She's getting more awake. And now finally, she's starting to find the areas in her own life where she has been discriminated against, treated unfairly, etc. And she blamed herself. And that's the number one thing that Black women do: blame yourself for something someone else. Like, she got fired. Oh, it must be her fault. It's not that, you know, they were discriminating. So I think it's just a process of, you have to go back. There's a term in, I think it's from Ghana, but don't hold me to that. It's called Sankofa. Have you heard that term?
Yes, I heard it last night at your
Oh, on my TED Talk. Yeah, that's right. So Sankofa is all about, um, you have to go back and bring your past with you. If you leave it behind, you're not going to be fully who you are. So even though the past may be painful and it's hard to look at, whether it's your individual past or our race's past, we need to understand what happened back there in order to be informed today. That's Sankofa, baby.
Okay, so now going back to like eating disorders. So if someone's listening that is struggling with their eating, or knows someone, what are some resources that you would recommend?
Yeah, I think certainly there's NEDA, the National Eating Disorder Association. There's what else? I think if you're struggling with an eating disorder, getting in touch with somebody at NEDA or even at our organization, IADAP, can help you find the resources that you need.
And then this is just a follow-up question. Um, with NEDA, do you find that that organization is culturally sensitive?
Well, according to Instagram, they're not. Okay, so maybe you should just contact AAEDP through, I don't know. It's,
Okay.
there aren't a lot of resources right now, particularly for, with people of color.
Mhm.
But I think, our organization, just our subcommittee, we have therapists, doctors, psychiatrists, dietitians from all over the country, and we're growing. So, certainly there are some opportunities to, help people to our committee.
Okay, great. And then lastly, how can myself and my listeners stay up to date with you and the work that you're doing?
Well, I have a podcast, the Carolyn Ross Show. So that's one way you can, it's on all of the, Spotify, Apple, et cetera, et cetera. And my website is my name, carolynrossmd.com. If anybody's interested in working with me on binge eating disorder or emotional eating or food addiction, my online program is called the Anchor Program. So its website is anchorprogram.com. So those are the best ways. And you can contact me directly through my websites. So either Anchor Program or through carolynrossmd.com. Yeah, and I do offer free consults if you want to, if you're struggling and you want some help in finding resources, or you can sign up for a free consult through my program.
All right, thank you.
You're welcome, Jayde.
Yeah,
It's
thank
been
you
so
for
good
being
to
here.
talk to you.
It's been great to talk to you too. I was so excited when I saw that you were a medical doctor and you were also an expert in eating disorders, just because I'm not even used to that.
Yeah.
And so it was really great talking to you. And I feel like I'm probably going to reach out to you again so we can talk about trauma.
Oh, for sure, I would love to.
Yeah.
Good.
Okay.
All right,
Okay.
great. Well, thanks for inviting me, and feel free to contact me to come back anytime.
Thank you for listening to this episode of Students of Mind. I am really excited about this episode. I have wanted to make something like this ever since I started my eating disorder treatment, mainly because I had a lot of family members who just didn't understand the disorder, and I wanted to help educate them because, having an environment where the people around you are educated about what you're struggling with just makes the struggle a little bit easier. So I'm glad that I'm finally able to put out something to help with educating people about this issue. And there's going to be probably several more episodes about eating disorders because there's a lot that goes into them. So stay tuned for those. I want to thank Dr. Ross again for being on the episode. It was really lovely talking to her. I learned a lot. So make sure to look at the description so you can see how you can contact Dr. Ross, utilize her resources or online classes, and also any other resources that were mentioned in the episode. Anyway, thank you so much for listening to this episode. Don't forget to subscribe, share the episode, and leave a review for the podcast. Otherwise, I will see you next time.